Hello folks, welcome to the Corner View. Folks, I was looking at my magazine here, Time, and I was looking, just flipping around the pages, and I found this ad for a drug, right? So hey, I check it out, right? It says that this aims to open airways to the max, right? Bevespi aerosphere, aims to open airways to the max. That's great, it's for people that have asthma, how great, this is going to open your airways, and but then I keep reading a little bit, and it says that if you have symptoms suddenly of COPD, to stop, to get emergency medical care if your breathing problems worsen, to call your healthcare provider if you see something out of what is normal. Other side effects including sudden breathing problems, serious allergic reactions, fast or irregular heartbeat, tremors, nervousness, new or worsened eye problems, urinary retention, high blood sugar. That's in the first page, guys. That's just this one. I mean, I go to others, there's this one, Opdivo, and they are great, right? But serious side effects may include lung problems, intestinal problems, colitis that can lead to tears or holes in your intestine. Think about this. Liver problems, hormone gland problems, kidney problems, skin problems, inflammation of the brains, problems of... So does anybody believe that these drugs are actually healing you? Do you seriously, when you are reading this, do you believe that this is actually going to bring you health when it has the possibility, and by possibility, the consequences, the side effects are incredibly dangerous? Do you believe this is a tool for health? Who does that? Who thinks that this is a way of health? And my friend, I know that we, the people, sometimes think that, and we think this because we've been told that this is the way. You go to the doctor gives you something, and it goes away, right? We don't think about what else do we need to do. My friend, I am here to tell you that any disease, number one, any disease comes from a sick body. If you are sick, if somebody is sick, that person is going to express his or her disease in one way or another. It could be hepatitis, it could be diabetes, it could be cancer, it could be many, many ways. But it is one body. If the one body is sick, you are putting stuff, you're putting stuff in it, you're making it sick one way or another. You are going to express the disease one way or another. They can give you something to dampen the symptoms and make you feel that you are actually healing, that you are actually healthy, but actually you're not, and you're going to express a different disease. All diseases, my friend, have two causes, two root causes, only two. That's it. Number one, either you are lacking nutrients, you are not eating enough minerals and enough vitamins, phytochemicals, enzymes, whatever, the whole enchilada. If you are not eating something that we need, you may have a problem. Number two, you may have something that you don't need to have, like heavy metals or some kind of toxicity, whatever, right? You have stuff that you should not have. This is going to make you sick. Any disease, my friends, any disease, anyone has one or two of these issues. So when they give you more stuff to make you, what are they fixing? Nutrients that you're missing? Yeah, right. You need some chemicals? Really? Is that what you're needing? or they are giving you more toxicity for you to not even express the symptom that you are expressing. My friends, we have talked before. This industry is made not to make you healthier. In no way, no drug is going to make you healthier. None, not even one, none, not one, is going to make you believe that you are healthier by mimicking the symptoms. But you know what it's going to do? It's going to make a lot of people wealthy. You are making wealthy some good doctors. And think about it. It's okay, because doctors need to have BMWs and they need to have, $5 million houses. I mean, why not, right? Some drugs, my friends, some drugs, I'm looking at the magazines here, and some drugs here at Bloomberg Business reports, is telling about some of the practices that some of the drug makers have. This drug, the name is, this drug, friends, Soliris, it costs $500,000 to $700,000 per year. And this is a drug that is to be taken for life. So the article goes on and on, and how the reps are actually, and the nurses and a lot of people are actually very inclined in have you take the drug, because it's a lot of money. Imagine you are $500,000, $700,000 for that company, when the cost to make the drug is minimal, right? Once you develop the drug. They in Brazil, actually, this company has gone in to make sure that they have some patients. They treat 0.0003% of the country's population, but they spent 30% of Brazil's judicialization budget in 2013 and 2014. So this is where there's obviously corruption, right? Now this company, they are talking about how whatever they are doing is not so clean. Now, my friends, do you think that this is not the case with everything else? Do you think that the doctor, the drug company, the hospital, and all of these people that are working to supposedly make you healthier, the hospital has equipment. They actually are the places where you see doctors, right? So it's I give you a little bit, I give you patients, you bring patients to me. So it's doctors and hospitals are very well tied up. Drug companies are tied up. If we have seen how the drug manufacturers pay thousands and thousands of dollars to many doctors so that they promote their products and so that they use the products, etc. Right? So, do you believe that this system that is created to do something like this, that is created to generate profit, is going to actually make you healthy? Just look around. Let me tell you a secret. I worked for a major company in the US. This company was one of the biggest buyers of health services after the US government, after Medicare and the US government. You take the US government, this company was one of the biggest. This company had Cadillac Healthcare, right? They had access to a lot of stuff. And this company, so I was an analyst, and I was analyzing all the data. We had all the data, every prescription, thousands and thousands and thousands of records. And we saw that these people that had access to so much healthcare actually were the sickest. They were the sickest of all, because I'm not going to deny that maybe there's a cultural component. Yeah, sure. Maybe these guys didn't eat very well. I agree. Okay, sure. But the other thing is that the healthcare that they were receiving wasn't getting them to be as healthy as you may think. So, my friends, when you take a drug, you are taking a drug that is actually dampening, is actually taking your symptoms away, but is not making you healthy. And you're going to take that drug forever. Many drugs are designed to be like that, right? All the drug lowering cholesterol, all the cholesterol lowering drugs are designed to do that. All the diabetes drugs are designed to, and most drugs are actually designed so that you keep coming back. But that is not healthier. You are not healthier. And you will have other symptoms, another disease that will require another drug. So, my friend, if you are seeking to be healthier, you are going to have to think of a different path. And we will evaluate that in another video. Thank you for your attention. This is the Corner View. Until the next time.